Hey everybody, Gene Ginsberg here. I have a very special guest today. Very excited to have Joe Hodas from GoFire. What's going on?
Thanks for having me. I appreciate it. Just trying to get back into the full swing of things after the holidays, and including our office and our team members. But we're getting there. So we've just launched a product recently that I'm sure we're going to talk about a little bit.
I'd love to hear all about it.
And we're in an interesting space. So.
Very cool. So I guess before we get into what you're doing now, tell us a little bit about your background.
Great. So I've been in Denver for most of my professional career. Grew up in Texas, but moved to Denver as quickly as I could, and have spent most of my career in public relations and marketing, kind of through the ranks of various companies like Frontier Airlines, and then eventually becoming a partner with an ad agency here called Vladimir Jones, where I was heading up our paid, owned, and earned media efforts for the agency. It was during that time that I actually ended up coming across a company in 2010 that was working on a pot soda, as they called it at the time, which I found very interesting, and they wanted some brand work. So we helped them. We did their logo. We did a little bit of research, and it was in that research process that I really began to understand the sort of dynamic nature of the cannabis industry. This was, again, 2010, so early days of medical cannabis in Colorado. But I was fascinated by it. So I kept in touch with this company over the next several years. And once adult use legalization was passed, we began talking more and more about me going back in-house corporate side for this cannabis company. And so I did that the very first week of 2014 when cannabis was legalized in Colorado, and became CMO for an edibles company called Dixie Brands for the next 4 years, and have been in the cannabis industry since, and am now currently the CEO of GoFire, which is a hardware, software, healthcare platform for managing plant-based medicine.
Right. So interesting background. So it sounds like you done some digital marketing in the past, right? And then
Yes.
and then was very fascinated with the cannabis industry. So some experience in the cannabis space. And then now it sounds like it's a tech company in the cannabis space.
That's correct. I mean, we really are. We can position ourselves more as a healthcare company.
Okay.
And we refer to products as plant-based medicine because that's kind of what we look at, is less about what the end user is using it for and more about what the actual product itself is. But it has a hardware component and a software component. So on the tech side, it's about as technical as we can get. The hardware device is a metered dose inhaler, and the software platform allows people to track, find, dose, track, and learn in regards to plant-based medicines in a community-based platform that really, I think, consumers are kind of missing in the plant-based revolution right now that's taking place.
So is this plant-based or specifically in cannabis?
It's going well beyond cannabis.
Oh, okay. I just wanted to make sure I was clear. That I understood.
Yep.
So it's not just cannabis. It's all plant-based medicine.
That is the intent. Yes.
Okay. Yeah. But you got started in the company got started in cannabis first.
Correct. We that's kind of where we look at it as kind of our sandbox currently, and but the goal is to extend well into healthcare.
Gotcha. And so the device itself, the hardware, you said it's an inhaler?
Correct. It's a metered. We call it a metered dose inhaler. And really, what it does is a couple of things. One is it solves for a lot of the issues that I'm sure you've been reading about, all the vape crisis out there right now, and our device actually happens to solve for all those issues. It does not require additives. It does not have any heavy metal touching any of the oil components. It is about as clean and pure a process as the end user can get. So that's where we feel like, from a technical standpoint, it is a vastly superior product. But on the healthcare side, on the patient tracking monitoring side, it allows you to specifically dose, which is something that really doesn't exist in the market currently. It allows that patient or that consumer to track over time the efficacy of the products that they're using, and it also provides each cartridge is enabled with a smart chip. That smart chip is programmed with the lab results of the products in the cartridge. So it also provides proof of supply chain for that consumer. They know exactly what they're consuming, exactly where it came from, and that there's a lab verified result that goes with it.
So it sounds like there's a blockchain component attached to it.
Well, we didn't build it on blockchain, but yes, similar approach. Yes.
Interesting. Okay, so it's not just cannabis. So what other types of I guess, products can you use in the hardware? Like any sort of inhalable
Well,
products?
I'm talking roadmap wise, in the future.
Okay, so not yet, but that's the idea, is to get like, so it'd be, I guess, similar to like an inhalable tobacco product.
Yeah, there's a lot of applications that potentially would be able to take advantage of a platform like this that don't exist currently, because if you look at pharmaceutical products, they actually in mainstream healthcare have the same issues in terms of dosing and tracking inhalable medicine. So we believe that there's potentially a plethora of different options that can take advantage of this platform.
Right. So, and then, so what's on the roadmap? You were saying that there is a new product coming out. So what does that look like for you?
Well, I can't quite share all that detail yet, but it's development. I'll say it this way: it is further development of our existing platform, but looking at what are other applications. I've kind of alluded a little bit to that earlier in the conversation, but there are a lot of other applications, and of course, all along the way, we're going to continue to, speaking of applications, focus on the quality of our software, on how we're engaging that consumer, how we're gathering that data and that information so that we're providing a service back to them, and how we're building community around the products that we're using and where they're finding efficacy.
Right. And so what was the problem that you were looking to solve originally when you first started the company?
Well, so to be clear, I didn't start the company. There's two founders. I don't want to take credit for it.
Gotcha.
It's a very smart product that I would love to take credit for, but I can't. But there's two founders that's really started the company. And they really started it because they understood what was going to happen in terms of what's happening currently with the vape crisis.
Wow! So they already had
and this has been 5 years in the making. So 5 years ago, they said, you know what, the products that are on the market currently that have been really responsible for a lot of the issues. They are very cheap products that come from China in mass quantities, and I think unfortunately some of the companies that sell those products were less concerned about the quality and more concerned about the price point, and did not give the consumer credit enough for thinking that they paid an additional couple of dollars for having a healthier experience. But that being said, back 5 years ago, we knew that heavy metals leaching into the oil was going to be an issue. We knew that dosability of products was going to be a challenge. And we also knew that having a way to verify these products so that you knew exactly what you're consuming was going to be important. So that began the development of this product. Again, 5 years ago, we finally got to market. We launched in November of this year. Soft launch, smaller launch, but we are now available in Colorado. And so that was a very exciting milestone for the company. But all along the way, not only did we solve for the issues that we just talked about, but we also began to realize that there's not a lot of tools out there for people who are interested in engaging in alternative medicine and plant-based medicine to understand not only the dosing, but also the efficacy of products. What works great for any of the 160 different options that we have within the app to help you with pain or anxiety, or very specific things like a neck pain versus a back pain versus there's, like I said, it's 160 different options. So there's really not a great toolkit right now for consumers outside of GoFire to look at that, to look at the information that's available and say, oh, well, this is a product that might work for me.
Right. And so right now you're just working, it sounds like it's a B2C play, right? So you're just working directly with consumers on this?
Well, it's our ecosystem is very complex, unfortunately,
well, that's good. Maybe you can share it with us.
It's not good. The reason I say it's complex is that, we have the device itself, then we have cartridges that can only be sold through dispensaries. Then we have the end user consumer who purchases those cartridges, but we also have along the way filling partners who fill the cartridges, and again the dispensaries that buy them wholesale then sell to the consumer. So we really have both B2B and B2C multiple touch points. So we have to make the consumer aware of the product and the availability of the product, and also make sure that we're creating an engaging platform for them. But we also really technically have to sell directly to those businesses to get them to buy. We sell hardware and software essentially.
Mm-hmm. So you're working directly with dispensaries, right? Because they're basically they're the ones basically in a way purchasing the product, and then they're reselling it back to the consumer.
Correct.
Right. And so you just said that you recently launched in November the hardware product. Is that
correct? So
it was it sounds like it was in the making for about a few years before you actually officially launched it. Okay.
Yeah.
Well, so was there just a lot of like R&D going on, or?
Yeah, there
Okay.
was a lot of R&D going on, and I mentioned earlier that we knew this problem several years ago, and the reason why it hasn't been fixed is because it's really, really hard to do. What we did, our IP, and we have patents on parts and pieces of this, really involves an extrusion technology. It's very similar. In many ways, it's kind of simple, but it's similar to a syringe in the fact that it extrudes the oil from a tip, and then it goes into an oven, which is thermally removed from the oil itself. So it actually is heating using superheated air. So it convection vaporizes the oil that's in the oven. The complexity of that type of a process doesn't exist in other hardware that's out there currently. And that's why it did take us quite some time to actually develop a product that we felt was solving the consumer issue, was a quality product, and allowed that consumer some flexibility in terms of how they consume plant-based medicine.
Right. And so are there other competitors out there who are, besides, I guess, I mean, the companies you mentioned who are, sounds like they don't have a lot of good quality products, but are there?
When I talk about the most common thing out there is what's called a 510 thread cartridge. When I talk about those companies, they're a dime a dozen.
Right.
When I was with my former company, Dixie, there's 27 different companies. I'm making that number up, but hawking similar products from different manufacturers in China. There's no brands. There's no really understanding of the product. You just buy 1,000 units or 10,000 or 20,000 units and you're on your way. So that I don't consider at all
a direct competitor, right?
There are some higher end companies that are developing technologies that I think are similar, but nothing actually compares when you talk about the ability to actually measure dosage in the way that our product does. And that's again where our IP is. You have companies like Indos and Dosis that are using inhalation timing to measure dose, which is not a very accurate assessment. You inhale at a different rate than I do, I presume. So what does that tell me about dosage if it's measuring based on both you and I having the same inhalation? So ours is a very precise product. And really that's why we also think it's very applicable to research and clinical trials, because right now nothing exists in the market that allows a clinician or a researcher to dose specifically the amount per patient across those patients, and then use the software platform integrated with it to be able to track the outcomes and the efficacy of the product. So that's a big area of focus for us as well.
Cool. So, and then you mentioned you have the software. So you have is that an app? Is that how it works? Okay. So what can you share a little bit about the app and how it integrates with the hardware?
Yes, and if I had been a little bit thinking ahead, I probably would have brought my device with me, which I did not. I apologize.
That's all right. That's all right.
We'll have to do that next time. But when I launched the app, it connects via Bluetooth to the device, and then it will show me specifically what is in that cartridge by the name of that product, and I can actually click on that product and see all of the profile information for that product, as well as the lab test results. But then as I consume, and again, I'm so sorry that I don't have.
Oh, no, that's fine. This is just, good to hear about it.
You can see like for this, it's tracking my sessions. It's tracking the number of times I've reviewed. It tells me the average dosage per session and the total milligrams dosed. So it's actually tracking that across days, weeks, months, years. And again, these are the reasons that I've said that I'm using the product: energy, focus, and anxiety. So I'm able to over periods of time, see what has or has not been effective for me, and perhaps then go back and find those products again if I find something that's really particularly effective, or I can look at it and say, oh, I know that this time of day, if I have 2.5 milligrams of X, Y, or Z, that is the most effective time of day for me to consume.
And the related products are yours products specifically, or are they related products that are also?
These are top rated products. Are some of these?
Yeah. Yes. Exactly. Yeah. Are these part of GoFire's products, or
we do not sell?
You do not sell it. You don't create any products.
We do not. We sell the hardware.
Okay.
In terms of the cartridge, an empty cartridge, which is medical grade plastic, and we sell the device.
Oh, so you actually don't have the plant-based matter that goes into that. So you do not manufacture that part. Okay, got it. I just wanted to make sure. So these are cannabis-related products that you can put into the device. Is that
correct?
Okay, plant-based products. Okay, got it. there's a lot of components to this.
Yes.
I was just trying to wrap my head around it because
Yes.
this is like it's kind of a new concept, I would say.
It is a new concept. And so, since it's about digital marketing, when we talk about the consumer and education, it is critical, right, for us to be able to educate the consumer and reach them in ways that are relevant to them, because this is a great app, and my team has spent a lot of time to develop some very thoughtful features to it, but it's not, I'll be honest, not the simplest ecosystem for someone to get into. So we do a lot of video content. We do a lot of, within the app, you can actually,
I was going to ask about the learn button.
Yeah, you can actually get into, a lot of different details, just our blogs, where we have a lot of posts that are about how to use the product and how to use the device. And so within the, let's see, within the support button, you can see that we have only Q&A, but we also have it broken down by, information about the app. So we have a lot of help information in there, so that our patients and consumers can access pretty quickly everything they need to know to be able to use the device and the ecosystem to its fullest.
And is there a community component to
Absolutely
this stuff, to the app?
And that's where the whole find component, the find products component, is most relevant. I can search by product type and by area, and it'll show me specifically at a store level where to find these products based on, again, the reviews. This is, it's right now pulling up anxiety search for me.
Mm-hmm.
It's showing me what has been most effective based on the reviews that have gone through our system. So these are reviews within the GoFire ecosystem, and they can point me specifically to that product, which seems to be best for anxiety, and where I can find that product.
Mm-hmm. Is there like a social media component to it, like where you can connect with other people who?
Not so much within the app currently, and part of that is, we also feel like we're doing that a little bit through the review section. So if I want you to know that, I found a product that's great for anxiety for me, you'll find that product within your searches for products within our system. Connecting consumers and patients, we're trying to stay as far away from any sort of primary health information, so we're not getting into HIPAA compliance, all those other issues. We're trying to stay as far away from that as we can. Now, we are very active on social media, but not necessarily within the app and connecting patients and consumers to one another. Does that make sense?
Sure, no, that makes sense. I was just more curious about, like, is there a community component? I mean, it sounds like there is a search component for like searching products, but I was more curious about like community component between like users.
Yeah, and I think, in many cases, users who talk about the product, and we do have a very loyal and strong following, small still, we need to increase that, but tend to find one another and share, concepts and ideas. And then for those that are really actively involved with us, oftentimes we feature them within our blog or within our social media to highlight what they're doing, how they're using the product.
Speaking of social media, that's actually one of my questions is, so how have you guys been using social media to get the word out about product, software, all of it?
Well, Instagram is probably one of our best performing platforms, as you would assume. We are growing our LinkedIn profile quite a bit. That's been, I guess I would say, our fastest growing platform for us. But LinkedIn, because of the nature of it being so visual and lending itself well to video content, really has been a very positive platform for us. That's the one that we use primarily from a social media perspective. But we also do some digital marketing through things like one of the platforms we use is called Informa, and it really targets physicians and clinicians. Mm-hmm. So we're able to, via paid media, display messaging regarding how our product can help with your clinical research to make it better and more effective, and that type of messaging, which then drives them to our website where they can download some more information about it. So.
And you're not having any issues with running paid media since the cannabis?
It's an interesting thing. I mean, so as I mentioned, I've been in this crazy business for about 6 years now. When I very first started 6 years ago, actually, when I very first started, there weren't as many restrictions because I don't think Google and some of the other platforms are catching on as quickly that, hey, there are legal cannabis companies out there advertising. So it was a little bit of a game of whack-a-mole initially. So companies would advertise, they'd figure out what the bad words were that they weren't able to use, stop using them, pop up somewhere else. Google would find them, shut them down. Same thing with social media. A number of occasions at Dixie, both my Instagram and Facebook accounts for the company were shut down.
Not surprised.
Yep, and we sat down across the table from Facebook. We had a number of conversations with them. Eventually, they reinstated some of us, but not all of us, and it's kind of been this ongoing back and forth battle. Now, all that said, fast forward 6 years, it's a little more stable. First of all, there are ad networks that are specific to plant-based medicine that have developed to kind of fill the gap. But in terms of mainstream media, there's also a lot of advertising networks, ad networks that have figured out where they can and can't play. And mostly it's a personal issue of the publishing platform as to whether or not they'll accept cannabis advertising or whether or not they want anything even related to it. Our product really is not, we don't discuss it. We talk about it from a hardware perspective and from a features and function perspective.
So it's just a plant-based product. It's not necessarily a cannabis product.
Correct.
Right. So you've been able to get around that by saying that it's a plant-based product and getting around that on like places like Facebook, Instagram, or whatnot.
I would say not even getting around it. I would say more so, we talk about this product from a healthcare perspective.
Right.
We don't talk about necessarily what goes into the device or where they can purchase those products. We just talk about it strictly from this platform, making it better and easier for people to access information around plant-based medicine.
Okay. No, that makes sense, because having spoken to a number of cannabis companies in all kinds of, all different layers, whether it's from, dispensaries to tech companies to people, to companies that don't touch the plant at all. It's very different on what can be and cannot be done. So
it's complex.
It is.
And there's a lot of companies. In fact, I met with a company a couple of weeks ago at a big conference called Philo, Fyllo, and I think they have a good-sized Denver presence. In any event, they're doing a lot of automated buying, and they've really got an interesting algorithm that I think allows them to access platforms that I think were previously unavailable to a lot of companies. So they're doing some good work.
So it's kind of like an ad network?
Mm-hmm.
Oh, okay. So specifically for the cannabis space, or partially?
Well, they really target well beyond that too, but they kind of focus Fyllo.
Let me make note of that so that I can remember that. Fyllo.
Yeah.
Got it. Okay. Interesting. I'll have to look them up. Cool. So you mentioned a little bit about some of the successes you've had in your business recently, like launching in November. So share a little bit more. What kind of successes have you guys recently experienced?
Well, getting this product launched, as I mentioned, being in development for 5 years was kind of a Herculean effort.
Okay.
We're still kind of basking in the glory of actually getting the product to market. But, we get great feedback almost daily from people that are using the product, that are finding benefit from it. We have things like the upcoming, the conference is called, I'm blanking on it. It's taking place in Pueblo. It's a big it's a big plant-based medicine research conference that we are running a whole track for. So they kind of liked what our proposal was, and so this is the leading researchers and scientists looking at plant-based medicine, and we are going to run a full day's worth of panels and discussions. So we're excited about that. And as I alluded to earlier and didn't tell a whole lot about, we're working on some exciting new products. So those are actively and rapidly coming to fruition. So
that's amazing.
Yeah.
That's fantastic. So we talked about wins, but let's talk a little bit about challenges. So what are some of the biggest challenges you're seeing in your industry? I mean, there's a lot, it sounds like.
How much time do we have?
I mean, we talked a lot about, ads and social media being some challenges, but so what are some of the other ones? I mean, it's kind of exciting, right? Because I mean, every time there's a challenge, that's always an opportunity for an opportunity, right? So
that's what the glass half full people.
Yeah.
I wouldn't mind a little bit of time with no challenges, but there's a myriad. There's obviously the whole consumer education aspect of it, but all along the way, there's changes in regulations, there's changes in packaging, there's changes in consumer perception. There's changes in state-by-state regulations. The complexity is significant, and so anytime there's even the slightest change to any one component of any of that, whether it's the products, the packaging, the regulations, any of that, it causes a ripple effect about the whole industry. Now, I can tell you currently, within the world of plant-based medicine, there's been a significant pullback. There are a lot of companies that use the public markets to tap capital, and they're beginning to, those capital markets are beginning to pull back. Investors are beginning to pull back. So it's challenging from that perspective because it's not a very mature industry, and there's a lot of R&D that has to continue to happen. There's a lot of, I think, innovation that can occur, but that doesn't occur without access to capital, and that's a really challenging area of the industry because of the banking and regulatory environment doesn't really lend itself well to easy access to capital. So,
right. And did GoFire raise any money for?
We've raised quite a bit of money, and we continue to raise money because our work is not done. We're trying to push as rapidly as we can to revenue so that we can be self-funded. But yeah, there's some R&D work that we're continuing to fund through our fundraising efforts.
Excellent. Wow. Well, that's very exciting. New opportunities coming up.
Yeah. Look, this is the very, very beginning phases of what will be a long-term, I think, industry that begins to meld into other parts of the world like healthcare and research. And so for all the challenges and for all of the frustration, those of us who've been in the industry for a little bit of time feel it is very, very early in the game, and there's so much more to be done. So.
I mean, this is just the infant stages for the cannabis. Speaking of which, I think this is my last question I was going to ask is, what is your prediction for the industry now? It could be for anything. It could be for the cannabis industry. It could be flying cars, AI. I mean, you pick it. Yeah. Anything. I mean, whatever you want, whatever you think is best here.
Wow. Well, that's a pretty open-ended question.
I know, but that's what I like to have people think about. Like, what are you seeing? I'm seeing self-driving cars in the next few years.
Look, I've talked to some friends who have Teslas, for example, who
it's already here. It's already here.
Yeah, I take my hands off the wheel, and I pay attention, but it's.
No, I actually I used to live out in California for a couple of years, and there's this thing called a test loop, and it's all over Southern California, and it's Teslas that basically allow you. It's for a group of people, so you can buy a ticket on Tesla, and you can go from LA to San Diego, or San Diego to Palm Desert, or LA to Las Vegas, and I actually did that a couple times because driving in LA is so crazy. Nice. So having that, we were I don't have to do anything. I can just be on my computer, and it's like a mini train, if you will, but only in a Tesla. And cool. These people were driving on the road, on the highway, no hands. Look at me, ma, no hands. So it's pretty cool.
It's here.
Yeah, it's already here. I mean, that was a couple of years ago already.
And I think one thing that's interesting is that, much like the self-driving car question, we saw this with one example would be scooters. Actually, cannabis is an interesting example of this as well. When cannabis launched in Colorado and other markets, the regulatory bodies that are really ostensibly designed to keep us safe and to create, the proper infrastructure to allow this technology to flourish, they can't keep up. I mean, I've had discussions with folks on the governmental side of this, and when scooters started to just show up on street corners, well, where can they drive scooters, and do you have to wear a helmet, and what happens if someone gets in an accident with one of them, and all of these questions that regulatory bodies generally try to solve, they cannot keep up with the speed of innovation, and so we're finding ourselves, I think, in a whole new world. Self-driving cars would be, obviously the next big example of that. And I heard, last thing I'll say is I was listening to, I think it was NPR the other day, and Hodas elevators. You know Hodas elevators?
Yeah, they're all in my building. I have
I mean, it's the most
6 elevators. All of them are Hodas.
Elevator company that I see, but I think of them as an elevator company being pretty boring and static. Well, so they were interviewing their innovation team, and apparently they've got an app that can identify all of the elevators within a given area of where you are that go to the top of buildings. Then they're partnering with helicopter companies that are looking to create low-cost helicopters, so that if I have my app, I can go, oh, that building right there, take it up to the helicopter pad, and take the helicopter from point A to point B, and bypass all the traffic.
That sounds pretty convenient for places like LA or New York City.
Yeah. I mean, I'd never even thought about that, but I was like, interesting, and Hodas Elevators is involved with that. So it's happening.
Well, that is pretty interesting. I don't know if the elevators into my building, you can actually go all the way to the roof, but maybe. Well, I mean, they go on the top and then just take the stairs, I guess.
Yeah, and if that became a thing, and of course they were talking about, well, they're helicopters are so very expensive and it's not really regulated and blah blah blah. So it's
maybe it'll be
legit yet, but if it was, I'm sure that buildings that wanted to take advantage of that would change their elevators and their structures.
Maybe not helicopters, but like drones that can pick up people.
Maybe
I've seen those on like Cheddar. You know that Cheddar?
Yeah.
Like where like they do all this like weird innovative technology stuff.
Yeah.
There's like drones for humans now.
I believe it.
Instead of just like drones for cameras.
Not quite sure I'd be getting ready to get in one yet.
Well,
not a couple more years on that,
but yeah, this is cool. Any other predictions for the industry? Again, it could be any part of the industry. It could be cannabis. It could be anything that you think is on the horizon.
Well, boy, I think that there's things that we're going to have to really, I'm not saying anything that isn't obvious, but things we really have to consider from a safety standpoint. I think that
like with drones for humans,
like drones, and from a privacy and information standpoint, but I think that with all that we're seeing right now related to fake news and fake media, there's going to be a shift there, and I don't know what it is, and I'm watching because I'd like to be part of the solution. I think there is an issue. I don't know what the answer is, but there are some things you're going to have to change as it relates to information, how we take in that information, how we verify information. So I think there's going to be some development there. You ever watch Black Mirror?
No, I've never seen it, but I've heard of it.
You never watched Black Mirror?
No, but I don't know. People have always told me about it. I've never watched it.
Oh yeah.
But I have I kind of understand the concept. It's about like potential futures. Is that what it's?
Well, yes, it's potential futures, but it's first of all most of the episodes seem to take place in what feels kind of current and today, but like leveraging different technologies that are future oriented.
Much more.
But it's a lot about like the dark side of these technologies and what that can lead to. But it's so close to reality that you're like, holy crap,
this
I can
could
see that
happen.
Easily. Like going from here to here is not that far of a leap. If you want to scare the shit out of yourself, watch Black Mirror.
Okay.
But it's fascinating. But that also is tells you a little bit about
what's like
some of this technology
on the horizon.
Yeah.
Well, that's interesting. Yeah. Any interesting episode, like one interesting episode from Black Mirror that kind of caught your attention?
There's so many good ones. Well, if you like John Hamm as an actor, he's in their Christmas episode that I thought was, John Hamm from Mad Men.
I never watched that show.
You'd recognize him if you saw it.
Probably, yeah.
You're
going to show me a picture of John Hamm.
You would know who John Hamm is. But anyway, that's a good one. There's one.
So what's the premise of that episode?
Well, that one's a little more complicated. It actually, I can't tell you the premise because if you ever watch it, if I told you the premise, it would ruin the whole episode.
Gotcha. Okay.
But another one is it's related to social media, and basically it becomes a social currency. So you end up with people who look to gain social favor. So I'd be particularly nice to you, so you'd rate me higher within my app, and I gain points, which gives me higher social status and currency within.
So it's like a gamification of social media in a way,
but in a very
dark way.
Dark way. So that was an interesting.
That could be. I mean, that could be the next social. That could be the next Facebook, right? I mean, not Facebook itself, but could be the next social media platform akin to Facebook. Right?
Easily. Yeah, this guy.
Oh yeah, I think I've seen him before.
You've seen him. He's a good-looking guy.
Yeah, good-looking guy. Yeah. Awesome. Well, thanks so much for being here. Anything else you want to add before we wrap up?
No, I appreciate your having me and this conversation.
I mean, I love learning about like new technology. I mean, which is why I started the Colorado Tech Startup Podcast, because I'm like, there's so many amazing Colorado tech companies, and I love learning all about it and sharing, everything that you guys have been working.
Well, I will say one more thing related to that. So, and next time I'm going to bring the device, you can actually see that if there's a next time. So
absolutely. There's always going to be a next time.
But there is actually a really nice contingency of startups in the plant-based medicine industry in Denver. Companies that are looking at complete CRM and point-of-sale systems that help with tracking of inventory. Great guy. You can Google him. He's been pretty visible. Kyle Sherman, who runs Flow Hub, for example, also a young guy. The founder of my company is 28. So these are all these young entrepreneurs in this space in Colorado that are developing really interesting tech platforms.
Well, I'd love to have your founder on the show too.
Yeah, well, you'd enjoy him. He's great.
What's his name?
His name is Peter Calfee.
Okay.
He and the other co-founder, John Woodbine, are the guys who really invented the product. So.
Right, but yeah, that would be awesome to have them on the show. Talk about.
We'll arrange that.
Yeah, that would be fantastic. That. Or anybody else any recommendations? Always open, always open for other people who are in Colorado tech, whether it's cannabis or not. We're open to all kinds of tech, and just learning about what people are up to because it's so cool. I mean, like you said, like things are just changing and shifting so quickly in tech and cannabis that it's like it's hard to keep track of it all. So
it's exhausting, kind of.
Yeah. Awesome. Well, thanks so much. Great having you on the show, Joe Hodas from GoFire, and we will see you here next time.
Thank you. I appreciate it.